Ladies and gentlemen, welcome to the world of everything you wanted to know about series but were afraid to ask. This is sponsored by Pradhan Dental Centre, and our focus is going to be talking about everyday problems with the relevant specialists in their field that will talk about the problems that we face in our lives in the medical field, specifically related to dentistry. And joining me on this program will also be somebody who will be helping me with the podcast, that is Dr. Siddhant Pradhan.
So this right here is our love seat or hot seat, depending on which way you want to look at it, where our experts will sit, maybe some of them in hot water, and we will try and make them tremble.
Ladies and gentlemen, welcome to the continuing series of Everything You Wanted to Know About series, and were afraid to ask. This time we are going to do everything you wanted to know about modern dental practices but were afraid to ask. And joining me on this show is my co-host Dr. Siddhant Pradhan and two very distinguished panelists from Pradhan Dental Centre, Dr. Madhavi Mehta, who has been with us, Dr. Madhavi Mehta, who's look, there are only three Guju surnames: Mehta, Shah,
And Parekh.
Patel. And Patel.
Yeah, looking samne, that's why I think Shah is coming, Anisha Shah.
Yeah, that's the problem.
Yeah.
So, distinguished guests on our panel today, Dr. Madhavi Mehta, MDS Endodontics from Nair Hospital Dental College in Mumbai, and has been in the practice for the last 28 years. Also joining us is Dr. Nysha Kotak, who's a BDS and has been with our practice for the last 8 years, and he specializes in restorative, pediatric and general dentistry. So the two of us will be now looking at what happens in modern dental practices. Our premise is one size, one hat does not fit all. That means that you need specialized treatments under one roof to be able to deliver the highest quality of dental services to our patients. That is our goal, and that should be the goal of every single dental practice that exists on the planet. So let me ask you, Madhavi, you've been in our practice for the last 28 years.
Right.
You have seen the upswing of the practice from being a practice with one dentist, so one hat fits everybody, to two dentists, and then when you joined, you were the third dentist in the practice. You joined as a specialist endodontist, because we at that point believed that, and those were the early days of modern dental practices, we believed that dentistry needs specialization to be able to deliver the highest quality of clinical outcomes to our patients. What would you comment on the journey that you have experienced so far and what you're seeing today?
So, first of all, somebody working in a single practice for 28 years itself says a lot about the practice. This journey for me has not only been one about professional growth, but personal growth also as a person. When I started in this practice, I was the only associate. It was Dr. Mr. and Mrs. Pradhan. And now we have more than 10 associate dentists and consultants working with us nearly the whole day.
Full time.
Full time.
We have only full time, and I think the number is 14, if I'm not mistaken.
Right.
It's 14.
14.
Yeah.
Right.
In our three different practices,
Yes.
because people, I think Madhavi has omitted a few. Because of personal animosity.
In fact, it's exactly the opposite. For me,
was the mother to all.
for me, it is about how this practice has built a team actually. Professionally, definitely every single step. It's like, is there a myth called as a painless root canal? I'm a root canal specialist. So is there a painless root canal? I feel Pradhan Dental Centre in its journey has made it possible to actually go from a root canal which was done in the traditional means to now when we are using a microscope to do most of our endodontic treatment, to give it the highest possible quality so that honestly the patient comes in pain-free. In the same way, the journey with the people in Pradhan Dental Centre has been totally of team building, starting with a number like a 3. Now, like Dr. Pradhan said, we are 14 of us. Every single time to upgrade our practice, consultants have been regularly been joining us full time so that we have a robust referral system. Like he always says, one hat doesn't fit all. If there is a thing that one of the consultants can be done better, there is a primary doctor, but it always gets shifted to the consultant in order to give the best treatment to the patient. For us, it is not about personal gratification. It is about what is best for the patient. And always in our practice, we have seen Dr. Pradhan has always encouraged us to put the patient first. What is the best outcome for the patient? Because of this, we have like continued meetings where we are always discussing cases together in how we can best service our patient in the best way. So for me, building this team, just like in every professional procedure, we are using the latest instruments, the latest techniques. We are right there where the innovation is happening. I think in Pradhan Dental Centre, it's about the people also. We are trying to get the best team every single day. And even the older team is trying to keep itself abreast of all the latest stuff with the help of our younger consultants also, so that we are right at the cutting edge of dentistry. So for me, that has been personal and professional growth in both ways.
Now that Madhavi has said it all, can we leave?
I don't think I have anything.
I mean,
What's left now?
I know.
what's left? रामायण तो हो गया.
You said my
अभी
share
राम की
also.
सीता कौन है? राम की सीता कौन
मेरा
है?
भी हो गया.
अच्छा, now we'll ask the next group who is Ram Sita. So,
Say something. Nysha needs to
You
say
said
something.
my share also. I don't think I have anything more to even
anyway, I think it comes to the next question, and we'll talk about technology a bit later, because I think there has to be a huge sort of segment on technology, because technology is what maketh the man in today's world, especially in the field of medicine and dentistry, where we are not using technology in most practices up to the optimum that is capable of doing. So, Nysha, I have a question for you. You worked in a one hat fit all, a one size fits all practice for a long time, 7-8 years, I think, and now you've been in this different hats for different sizes and for different people and for different needs and purposes. So, tell us your opinion, because it's extremely important for somebody who's watching this this program to understand where your journey began and where it is at today, and comparison of the two directions.
Okay, so I've been working with Pradhan Dental Centre for 8 years now. It's been an amazing journey. I've really grown a lot professionally. So, but otherwise, like I've been in dentistry for 19 years, and I have realized how crucial it is to get a patient a seamless and a coordinated care. So at Pradhan Dental Centre, that is our motto, a simple and powerful one, where we have all dental specialists under one roof, be it from oral surgery to orthodontics, periodontics, prosthodontics. The entire team is working hand in hand so that the patient benefits. We can give them correct diagnosis, perfect treatment plan. This saves a lot of time for the patient. You don't have to run around anywhere, no referrals, no running around. Great coordination, and they work well. The patient also saves time, and basically it's a multidisciplinary practice, and that I think is the future of dentistry.
Yeah, so that is where I actually came into belief that when I was going for conferences abroad in the beginning of my practice, and at that time I believed that one size, one hat will fit all, and then I realized that no,
It doesn't.
there is an inadequacy within me because of a lack of training in that particular field of dentistry, that somebody who's trained better will
Should
be able to deliver the best clinical outcomes to our patients, and therefore enhance the quality of treatment at every single level. That's when I started looking at expanding, but not just expanding by getting more people in to multiply your numbers, but to get specialists in that will be able to deliver the higher quality of dental practices. And I think today we are where we are because of that as a concept. And I think it is a concept that can be replicated, but it's a difficult
difficult.
replication.
Yes.
It's not an easy replication, because amalgamation of all of these
Together.
various people into a practice is your HR challenge, and that's really where the
challenging.
problem lies. Thank you very much, both of you all, for having spared your valuable time on a Sunday away from your families and your loved ones, which may or may not exist in this.
They're also not necessarily the same thing.
Definitely.
So thank you very much, Madhavi and
Thank you so much.
Nysha, for being a part of our practice. We enjoy working with you, and we hope that this lasts for a long time. Here we have, on my left, Dr. Anisha. Shah has been in the practice for the last 15 years. 15 years, Anisha?
More than 15.
More than 15. Shah is a general dentist, but with a special focus on full mouth rehabilitation and aesthetic dentistry, and has taken a lot of courses in things and has specialized those areas. So, Anisha, my question to you is: when you joined as a reasonably fresh graduate after your BDS, you had worked in a few practices before, and then you joined in. How did the vision of our practice differ from what you were used to or what you had in mind at that point? And then the growth of our practice, did that coincide with what you had in mind as your personal and the growth within the practice? And how has it shaped the way you have viewed dentistry?
Like he said, I've been working for over 15 years, almost 20 years. This practice itself, it's been more than 15 years. So when I entered as a young dentist, eager to learn, trying to find my footing in the practice, I was surrounded suddenly by specialists from different fields: prosthodontics, endodontics, pediatrics, laser. So, that instantly actually pushed me that I must grow. I must not only, it made me instill passion to learn new things, learn new technologies, but at the same time, I was not stuck with a single focused approach. Like how ma'am would say about functional dentistry, it just widened my horizons to look at every clinical perspective or every clinical case in a different way. So that actually helped me grow in various fields, and of course, I later on went on to specialize myself in aesthetic dentistry and full mouth rehabilitations. But that is the most important key for my growth when I look back, that the environment that you're surrounded with doesn't only challenge you, but it instills the passion in you that helps you grow as a clinician, as a dentist. Personally, it helps you grow and also motivates you to learn new things, to look forward, and hence I'm really excited to look forward. But yeah, so that's why I feel every smile that we restore actually helps you look back and reminds you the very reason why you're here. It's wonderful, this
I mean,
this collaborative approach. Actually, that's why it helps you, like for a person like me who's come with very little knowledge of, only that you've taught, and then you are looking in one direction. It helps you mold in different directions. It helps you look at a different angle altogether holistically, and that brings about a better clinical outcome for the patient, and that is what keeps me going, I think. And that's what is the best thing that I've learned from
the
here.
bottom line is, we are here for our patients.
Yes.
If we did not have the patients, we would not be here even talking to you. So I think that we have to understand that the best clinical outcome for the patient is what we have to strive for, and keep on improving it. The moment you stop, the moment you're static and not dynamic, like with the navigation system,
Well
then
played.
if you're static, that is the end of you as a professional. Then you're caught in this little bubble, and you cannot escape that
Yes.
bubble even though you're trying. So thank you again for that sort of response there, Anisha. The last in this
What's coming?
is
You know, if you could put a gun to two people's heads, they wouldn't blow themselves off any faster in this situation.
Thanks, huh? I love you too.
so anyway.
Okay, I can
regress. I have to introduce next guest, who also is Dr. Shalini Pradhan, one MDS from Naya Hospital Dental College, specialist in pediatric dentistry. And that's been her forte for many, many years. Before there was MDS in pediatrics, she was a registrar in Naya Hospital, and I remember those days. But she's also written a
I
book.
was just going to get to that.
A
She's
book
also an
on-
author of a children's book now.
I know. Can you imagine that? Which is
I can't believe it too.
and
But-
she's created a monster. I don't know. Maybe it's been designed by certain people that we may or may not identify with. But she has designed the monster, and she's designed a good person. The dentist board, by the way. So yeah, so that is her claim to fame. Apart from being a very capable and on the front line of pediatric dentistry. So my question to you, ma'am, is.
Oh,
Who's-
not gonna ask for
Respect.
too much
That was
respect.
out of respect.
Out of thank you.
My question to you, Shalini, is
Very simple. When we started the practice, because we started the practice together before you, but you had not joined the practice for at least a year and a half. You were still doing your MBA when you got married. So when you joined the practice, did we ever imagine that we would be sitting here with so many of our family, and this is my family, because they mean more to me than my, you have family by birth and your family of choice, and this is definitely my family of choice. So the question is, what would you say was the highlight of our journey so far? This is 37 years now.
I think the highlight is the scales that we've been able to manage, and within those scales, keeping all our patients in mind with profound and lasting relationships with our patients. We're able to get in all the experts, allow them to treat the patients, give the patients the best, and grow our base really widely. And I think that could be our experience. Also, we have a collective experience. It's like 38 years of all of us together pulling in not only academic, clinical, functioning, how the whole system works, how to tweak it, how to change it. We're all piggybacking on that over many generations. So we are baby boomers, we have a 50-year-old, we have a 40-year-old. Recently, we had a Gen Z who joined us. And it was amazing because all their wisdom, all that they bring to the table was incorporated within this whole functioning system. And I think that's the trick. That's why it really
we were able to make reads out of it.
yeah. Gen Z or more. Because the Gen Z with their terminology and what all they brought to the table. And of course, all our 50-year-olds, our 40-year-olds, our 30-year-olds, and they all brought something to the table. But the prime importance to me was maybe there were all these experts, there's all these machines, collective academic intelligence and experience. All that is piggybacking all this technology. But at the core of it, I really think our relationships with our patients matters the most. We're still able to see those patients. We all know a lot of the patients for so many years. And I think to achieve that is great because in India, it's a one-on-one relationship. You go to a certain doctor because you know that doctor and you have an equation with that doctor. And that is very profound in dentistry because you're not gassing the patient and taking out their guts. You're sitting and, talking the patient through a whole potentially traumatic experience. And there to maintain that relationship is very important. To me, that whole structure is what brings value to the whole place.
I would say that the summary of a high quality with the great clinical outcomes, modern dental practice would be great treatment planning, one, because that at least compromise treatment planning for the patient, like fixed temporization for temporaries that are fixed, because people want fixed, they don't want removals. And from that point on to the best treatment modalities possible. So you need one treatment planning person and a coordinator who will follow every single step of the patient all the way through and will be finally present in the end. And in the middle, you will have all the specialists in the various fields contributing their expertise to allow us to deliver the highest clinical outcomes. And that is the philosophy that we work on.
Does it matter who the coordinator is?
It matters a lot because that coordinator has to also have a relationship and equation
That is the most
and
important.
empathy with the patient. And that's what empathy is
It's the key.
always said but less understood. And that is the absolute key to our relationship. So if you empathize with the patient, what I always tell all my students, unfortunately, I have a lot of them. I always tell all my students that if you're not empathetic to your patients, put yourself in their position and then think of what should be their next outcomes. So that is, I think, the bottom line, and we pride ourselves in that, and we hope to be with you in the future, and we hope that this series of whatever podcasts, reels, or whatever we are doing, trying to educate the public at large, and some of the dentists who might want to take hints from our experiences. Hope to see you soon. And thank you, everybody, for being a part. And I would let my co-host say the last words.
Oh, I'm just literally going to say the last words. That's how we'll end it.
I think the last
Words.
it should be that I think all of us have to learn to unlearn to relearn.
I think
Because that, yeah, because if you don't, from where we come and all our fixed ideas, they are so rapidly changing in every which way. So if we're not able to unlearn, we're not going to relearn.
I think it has to also be a collaborative thing. Start with one, it'll divulge off to different people, and you come back to that one, like you said, the coordinator. But it has to be collaborative from everybody, and that's the important thing.
absolutely. But there has to be somebody that the patient can relate to,
Connect.
pick up the phone, talk to, have an interface
Yeah.
for the specialists to deliver their quality of treatment to the patient. And that, I think, is the bottom line. And if you can follow that, you won the war, not even the battle.